welcome to the podcast, John Bowman, the CEO founder of SureMed Compliance, and a friend through your brother, through your nephew, who's a
Yeah.
buddy of mine, right?
Yep.
So I want to share your story and what you're working on. You have a mission-based company. You're doing some cool things. The first thing I want to share is sort of the journey from what led you to where you are now as founding a company, which is hard, and sort of like made you take on this important task. And then I do want to share a bit about the mission of the company, because that is truly important, and it's something that I think we've seen in the country when it comes to the medical and healthcare industry. I think your mission is it's an epidemic, right?
It is,
Overdosing,
yeah.
right? So tell me about that. How did we get from where you are now or from where you were to where we are now?
Back in about 2015, we had started to notice that heroin was kind of a big deal in Bradenton and Manatee County. It had actually been a pretty big deal around the rest of the country. Black tar heroin was coming in from these sort of decentralized cells from Mexico, but right here in our backyard. And it was actually for one period of time, for about 6 months, Manatee County was number one per capita in overdoses, opioid-related overdose
Oh my
deaths.
God.
And we're not even the biggest county in Florida. So at that time, I was actually working on another startup project at a private Christian school in Northwest Bradenton. And a good friend of mine, Robbie Stevenson, who was somebody I went to high school with, somebody I went to college with at University of Florida. He was a Manatee County Sheriff's deputy at the time, and he was picking people up that had overdosed from heroin. And some of these people we went to high school with. And we just started to put our heads together and try and figure out what was going on. There wasn't a lot of data back then that we had access to kind of figure out what was going on, but we looked up some prescribing data, and this is before the New England Journal of Medicine released their 2016 correlation of non-medical use of opioids and heroin article or journal that they published. And so, but we did notice that the number one prescriber of both hydrocodone and oxycodone in the entire United States by volume was in Bradenton, Florida.
Wow.
So So we started to just kind of think about it. We did a little bit more research, and we thought to ourselves, this can't be a coincidence that this is what's happening. Of course, in 2016, the New England Journal of Medicine did publish that. I think in January, published that article that showed that there was a correlation between non-medical use of opioids and heroin use. And so from there, it just became a passion project. At that point, Robbie and I decided we were going to try and figure out how to solve this problem, and that led us to understanding that most physicians did not actually, who were prescribing these medications, didn't really spend a whole lot of time asking patients questions about risk factors that could lead them into substance use disorder.
Hmm.
And so that was sort of the genesis of it. It evolved, and we pivoted quite a bit in the beginning years of that. We really didn't even have a company. In the beginning, it was called SafeMed Compliance. And we were just had binders. I remember going in and training offices on how to prescribe more safely. I mean, you have to imagine me. Took me 6 years to graduate with a bachelor's degree in history and religion, and I'm teaching doctors on safe prescribing. I mean, you talk about imposter syndrome,
Right.
I remember coming home one day and telling my wife, I said, doctors were taking notes. I can't believe it.
Yeah.
They were taking notes on what I was saying. But we studied at the time, there really wasn't any other guidance that was out there. The CDC had not yet published their guideline yet. They did have the Federation of State Medical Board guideline from 2013. So we heavily leaned on that. And then we leaned on University of Boston, Boston University, Dr. Daniel Alford. He had a website, was a really good resource. It was called scopeofpain.com, still around.
Mm.
And we would sign up for just about every CME, continuing medical education credit. We weren't doctors. We weren't going to use those
Sure.
credits for anything, but we would sign up, and we would just, we would read and we would learn. And Dr. Stephen Pasick had published probably about 150 articles, peer-reviewed literature in a number of journals about urine drug testing and, sort of forensically looking to make sure that patients were taking the medications they were being prescribed. And it just opened up this whole nother world to us. I mean, for about a year and a half, I did nothing but study case law to find out what's the penalties if doctors don't do this.
Mm.
And is there any case law? And there was actually quite a bit of it, criminal case law, civil case law, and regulatory state board stuff. So I'm sort of an amateur attorney. I don't practice, obviously, but
Yeah.
I remember the early days trying to read case law and not understanding what any of the words meant. And I would have to Google them to figure out
Yeah.
what they meant, just so I could digest that
All
information.
the
So
legalese.
yeah.
Yeah. Well, that's awesome. I mean, you know, over the last decade or two, you just hear about, different areas in the country that are popping up with, massive overdose numbers. And you're like, how is this even possible? I mean, obviously there's illegal ways to get drugs, but you're thinking about drugs that are being prescribed. Um, it was getting sort of worrisome, especially in schools. Heard about that all over the country. Um, that's really interesting. So now to today, SureMed, where are you guys in your sort of evolution? What's sort of the where have you been and where are you going, as far as sort of scaling the company?
So in the early days, we were literally just trying to teach physicians how. I don't even know that we had a real business model. I mean, product market fit, didn't even know what the word meant. I
Yeah.
mean, we were going in just saying, "Hey, do this more safely," and it was a passion. And in the early days, we were sort of telling physicians, "You're killing your patients if you're not asking them questions,"
Yeah.
and that doesn't
Wow.
resonate well.
Yeah.
And we got kicked out of a lot of offices with that kind of language. And so we shifted a little bit, and we said, if that's not the teeth that's going to get, I'll tell you, there's a guy named Rich Swire. I don't know
Okay.
if you know
Yeah.
Asunta and Rich.
I know
I
Rich.
had dinner with Asunta and Rich years ago, and I remember telling Rich about my idea and we were going to build this company. And I remember him saying, uh, "John, there's no teeth to this." And he was super honest. And I have a lot of respect for Rich because of what he's been able to do. He said, "You need teeth on this. There's no teeth. How are you going to get? What makes them have to use this product?
Yeah.
Not want it. It has to be a need, not
Yeah.
a
How do you
want."
stop a facility from prescribing drugs where they're creating a profit, right?
Right. Well,
To some
and
capacity.
to some degree, yeah, because those patients were repeat customers
Yeah.
and they don't go away, right? Chronic pain, those are evergreen patients. They stay forever. Um, but we had to pivot at that point, and I realized that what we were saying wasn't resonating, and so we said, and as it was actually that dinner that had us really start challenging some of the notions we had, and we started to go much more of this medico legal approach. We started to really investigate what is the penalty if a physician does this wrong, because that's the only kind of teeth we could find was, by the way, there's a lot of risk if you prescribe these things the wrong way and something happens. And so in the beginning, it was just training and education. When we finally set out sort of this definition of legitimate medical purpose, which is a rule that was promulgated by the DEA, it's been invoked in almost nearly every single case against physicians since it's been invoked, or pardon me, since it's been defined or promulgated. In 2006, the Supreme Court actually ruled that the DEA cannot even invoke it. They can't define it. It has to be the states that do that.
Mhm.
But if you look at the most recent cases against doctors that was published in, I want to say 2013 that the DEA published, there may be another one that they published after that. Almost all of them have that phrase legitimate medical purpose in there. We set out to define it to figure out, and up until 2016, only two states actually had a definition, even though the Supreme Court said that it was supposed to be the states that are defining this.
Mm.
And so we studied the case law. We went in and we started to tell doctors, here's the 16, 18 different things that you have to do before you prescribe an opioid. And they just looked at us like we were crazy. They were like, "Well, go to business doing this. We spend 5 to 10 minutes with our patients. We have to see 30 plus patients to keep our lights on."
Right.
And so that was when the idea of software came up. It was actually a guy named Dr. Jeremy McConnell. He's a doctor here in Bradenton. He works with patients that have sleep disorders and things like that.
Mm.
Brilliant physician. And he said, "John, it's got to be software." Jeremy, I hope you hear this. I'm giving you props. Um,
We'll tag them.
that's right. Yeah. He said, you have, this has to be software. And at that point, I was working over at Inspiration Academy. My wife and I were some of the founding members of that school working to help build it. And a guy named Eddie Spear, who had just sold his technology company and moved here, sold a product called Mortgage Cadence to Accenture for quite a bit of money. And he moved here and we were working together and he just said, "I can help with the software thing." So he introduced us to some people on his team that he had.
Mm.
And sort of the rest is history, as far as like we were going to build a piece of software that automated that process so physicians didn't have to do it.
Sure.
And so, you asked about scaling and where we're at now. Um, we fumbled around a lot in the beginning. I mean, it is only by the grace of God that we were able to even stay alive long enough to finally hit profitability. Most companies don't get as many chances as we do. Um, we were about to, we actually didn't have any money in the beginning at all. I ended up leaving Inspiration to do this full time. A guy named Chris Cox, who I think I mentioned
Oh
earlier
yeah.
to you when
Yeah.
we were talking, who's the owner of one of the owners of Cox Chevrolet, is a good buddy of mine. I went to him, I told him what we were doing, and he said, "What do you need?" I said, "I need like $30,000 to survive over the next 6 months so that I can continue to do this." And he wrote me a check for $30,000. He said, "I believe in you, go do it."
Nice.
And so we cut back all of our expenses. We exhausted our savings. I was working with Robbie Stevenson at the time still, who was helping with this, and we were trying to grow the company that way. Um, and then right around January of 2017, I guess, or right around January of 2017, Robbie and I started to go look for investors. We just said we have to find some money here, but we weren't really finding the business model yet. And I was running out of that money that Chris gave me, so I said we got
Yeah.
to go find some help. We toured around. We went to Memphis. We went to Alabama. We went to these different places. It just so happened that at that time we were actually getting pretty good momentum with the state medical board in Alabama,
Mhm.
and they were very interested in our model and what we were doing. And we met with some investors in Mobile, and they liked what we were doing. And we were trying to sell them actually a license to this program that did not wasn't fully baked yet.
Yeah.
And there was no software at all. But they looked at us and they said, "We've already built this software that you're trying to do.
Hmm.
We're using it for something totally different." So they said, "Here's what we'll do. If you want, we're not giving you," we were asking them for $250,000 for a year license to something we hadn't built yet. And the the owners were like, there's an old saying, "Fake it till you make it."
Yeah. You
We're
gotta
just
make it
doing
happen.
anything we could do to try and make it happen, believing that we would pull it off if we could just get the money.
Yeah. Yeah.
And the investors looked at
Wow.
us and they said, around a table, they just said, "We're not going to give you $250,000. We don't believe that you have a product yet that's going to do this." And we're like, "Well, it's close, And they said, "But we believe in you and we believe in the model and we've already built the software. Let me show it to you." And they showed it to me, and it did exactly what I wanted to build anyway. And so that was the first sort of version of the software for SureMed compliance.
Mm.
And they said, "Let's just restructure the company. Come on up." And we redivvied the shares with their board members and ours. A couple of our members got bought out, which Robbie and two other people that were on the team actually got bought. They got a check and decided not to move.
Sure.
And I relocated with my family to Alabama, and that began the real journey of entrepreneurship.
Nice.
We I didn't have a clue what we were doing yet. I didn't really truly understand. I had not read any. Entrepreneurship is kind of a fun thing now, where there's books on it. There's people that talk
Yeah.
about it. I can't look. I mean, every LinkedIn profile says influencer and entrepreneur and coach to the coaches, and you're just like,
Yeah.
none of that existed back then, as far as I
Yeah.
know. I mean,
Yeah.
it was sort of, and people were doing it for sure, but we weren't making so much noise about
Right.
doing it. There wasn't all these talks about it. So we, with the leadership that was at those investors, and they had already started a very successful company, we started to kind of just build this thing out and started to sell it to doctors and messed around with our pricing model 1,000 times before we finally trying to figure out what our ceiling is and what the market will allow. And
Right.
and then right around 2018, um, the third largest med mal company in the country, a group called Pro Assurance, we were presenting this idea to them, and they loved it. And they did an exclusive nationwide affiliation with us, which means we're
Wow.
not giving you any money, but we're going to partner with you, and we're going to push this out to all of our insureds to see if we can't get this in their hands. And I remember that being a really big moment for us because
Yeah.
it gave us legitimacy all of a sudden. Um, and we hired some people. The investors continued to put money into the company to keep it alive. And it was kind of like that scene in Ghostbusters. Do you remember where they set up shop in that old fire station, and
Yeah.
they hire the lady,
Yeah.
and she's sitting there and they keep walking out going, "We get any calls?" She's like, "Nope."
Nope.
We had like 4 people in a call center. We put a ship's bell in there with a counter, and it was like we were going to count all the lives we're going to save for all these companies that call us. I mean,
Yeah.
it
Yeah.
was, a little bit of dreaming there. And the phones didn't ring,
Of course.
and so, we weren't, that alone wasn't enough we thought, oh, as soon as Pro Assurance sends these emails out,
Yeah.
we're just
Yeah.
going to get all these calls. And we didn't get hardly any calls at all. And at some point, the investors were looking at us like, we're not going to keep putting money on this thing if it doesn't do something, right? Because we're talking, we've been doing this, 3 years at this point. Um, and at that time, somebody that was on our team had actually somebody reached out to her from the National Institutes of Health and said, "Interested in what you're doing. Can you come to DC to present this to us?" And we were like, "Oh, okay. Someone's paid attention." I don't even, maybe it was the press release from Pro Assurance that
Yeah.
got their
Yeah.
attention. And so we flew up to DC. We brought a team with us, and we presented to the National Institutes of Health. I laugh at, I'm sure, what our presentation was like. I always, back then I was like, "Oh, we killed it," and
Yeah.
and I look back, I'm like, I don't think we killed it
You're like,
probably, but And, they really liked us, and they liked the again, everybody kept buying into this idea, I think is what it was. We showed them the software,
Yeah.
what it was doing. It didn't have any EHR connectivity or integration, so it was very manual. Still, even though software was doing it, physicians don't like logging into separate softwares. They wanna be able to
Yeah.
have everything inside the electronic health record. A lot of challenges that we had. The pricing model we couldn't figure out. You know, if we put it at 450 a month for the people to use the software, only the people that were about to go to prison
Sure.
bought it. And they were like, this is cheaper than an attorney. Let's see if this works
Yes.
before, and if we put it to like 99,
Wow.
we couldn't really make a profit. Selling into that industry is difficult at $99. There's no less than 5 decision makers in every doctor's office.
Yeah, it's tough.
So, the NIH ended up telling us, we think you should apply for this challenges program. It was through NIDA. And they said it's the challenges program. We pick 10 winners every year across the country,
And what's NIDA?
National Institute on Drug Abuse.
Oh, got it.
And so it's part of the NIH, it's part of the National Institutes of Health. And they said, we think you should apply for this. And we did this application. It was pretty poorly done. And we ended up winning. I just think, like, again, I
Wow.
feel like God's favor has been over this from the beginning. And I
Sure.
really feel like, I think that every time we talked about what we were trying to do, they just saw like a bunch of really ambitious, not maybe not exactly who you would expect to be doing this, but really ambitious people that were willing to just fight for
Yeah.
whatever it is that we needed to do.
Well, I mean, I see in the story resilience in that, you know, it wasn't immediately profitable. It wasn't immediately easy to go against the grain. It's a lot easier to do the other thing, which is like, hey, on the other side of this, there's a lot of profit and just like the flow is happening. I can just jump into the river and it's going to take me downstream. This is like I got in the rapids and I'm paddling upstream against the falls at every step of the way, but you just kept doing it and you just happen to get to places where people are like, "Oh, hey, let me throw you a rope," you know?
Yeah, if you say to yourself that the mission is there's nothing above the mission, not
Yeah.
me, not any employee we have. If you say that and you say that, so if I'm not moving it in the right way, if somebody on the team's not doing whatever it is,
Yeah.
if the mission isn't the thing that guides you, we had so many people along the way say, "Hey, you can make money doing this. Hey, let's link up with our company because you got all these contacts in pain management and sell this product or do this or do that and you'll make money and they'll bill Medicare and you should see the the scam artists that are out there in
Sure.
this industry."
Yeah.
And there were times where we were like enticed because we were like, "Geez, we need money really bad. Should we partner with this company?" But everything got run through the filter of the mission, and usually, almost every single time, we were like, "This doesn't really work. It doesn't align with what we're trying to do." And so you just keep fighting it. There wasn't an industry. The opioid prescribing compliance industry didn't exist. There was no follow the leader. So we were just like figuring it out. Again,
Yeah.
I almost feel like, and I'm grateful for it. I heard somebody say this. I don't know if it's true or not. I heard somebody say something that, like, I think it was Bezos or somebody said that the longer it takes you to start the company and build the company, the longer it'll last.
Mm.
And I'm finding that to be true. When you hit so many roadblocks and you find a way around them, you find a way over them. You stop looking at roadblocks so much. I'll give you a better way of putting it. When 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 God rescues you over and over and over and over again in this journey, you stop doubting whether you're going to get rescued again. Even when you're at death's door, even when you don't have any money to make payroll, which has happened probably 3 to 4 times in this company at least, where we thought we were going to shut our doors. We were about to shut our doors right before we met with the NIH. And
Mm.
then we won this Night of Challenges program. They don't give you a lot of money. It's like $10,000. So, but then they put somebody next to you, like a sponsor that helps you write an SBIR grant, which is a Small Business Innovation Research Grant.
Mm.
We did a direct to phase 2, which never gets funded, by the way, the first time. Actually, 50% of those grants don't even get scored.
Mm.
Um, we wrote this grant. We were trying to submit it in April. We partnered with the University of Florida, the College of Pharmacy there,
Yeah.
found a principal investigator somehow, Dr. Bram Hartzema, who's been just a godsend. And we tried to submit this grant in April of that year. I think it was 2019 of April. We were trying to submit the grant. And there's like 5 different registrations that have to all align when you're submitting a grant. Otherwise, it says error, when
Right.
you're like, and there's like the deadline, and you're just sitting there going, "Come on,
Submit,
man, come on."
submit.
And it wouldn't submit. And it didn't. We missed the deadline. And I remember being crushed. I was just crushed. I mean, I'm just like, and I remember thinking, why in the world did that? Like, God, what are you doing? And so we sent the grant back to the sponsor, and he read it, and he was like, "It's so good you didn't submit this grant. There's no way this would have been scored. You're missing a lot of stuff that you need. It's not well written." We went back for the next 3 months. I'm really grateful to our investors, our early investors at the time, because they believed enough in what we were doing, specifically a guy named Brad Pitts, not Brad Pitt, but Brad
Yeah,
Pitts.
close.
But he believed enough in what we were doing that he just said, keep going for it, keep going for it,
Yeah.
keep going for it." Most investors would have been like, "We're done here. We tried, we gave it a run. Thank you," but you know, but he didn't. He kept pushing and saying, I believe, keep doing this." So we submitted. We didn't submit the grant. Went back and worked on it some more, and then we submitted it. I think in September of that year. It didn't get scored. Oh no, pardon me. It did get scored in September, and so they tell you there's a couple ways that you know whether it got scored or not. And so, in order for a grant to get funded, it has to go before the council. So if it goes before the council, they call it the council meeting. And at that meeting, all they're doing is just looking like, okay, 5 minutes, going cool. They usually say yes to everything that goes to council. If it goes to council, it typically gets funded.
Yeah.
We had not gone to council in January of that year, and I called up our sponsor at the NIH and I said, "Does that mean we're not getting funded?" And it's like, "Well, yeah, you didn't go to council." And that looked like the end of the road for us because we had run out of money at that time. Brad, this guy who had been fighting for us, was also facing the other investors that were basically telling him, like, "Cut your losses, man. Get rid of this
Yeah.
guy. Get rid of this thing." And so he just looked at me. He's like, "John, I don't know how much longer I can hold everybody off and keep doing this." Like, and I said, "I totally understand." I go, and at that point, I'm thinking, "Am I moving back to Florida? What am I doing at this
Yeah.
point?"
Yeah.
And we had spent so much time in Alabama, and I kept thinking, certainly we didn't move here for this just to fall apart like this. And my wife came to me and she said, my wife has prophetic dreams, by the way. So anybody who sees this is going to be like, "Guy's a lunatic." Um, I hear you. I hear you. If you're out there listening to this now, but she has prophetic dreams, and and I used to laugh when she'd say things, but so many of them come true that I'm like,
Yeah.
geez. So she said, and she didn't know this whole process, by the way, this council meeting and all that. She said, "I had a dream that you came up to me. I was standing in the bathroom. You walked up from behind me and you said, our grant made it to some meeting. It went to some meeting." And I said, "Council meeting?" And she goes, "That's what it was, a council meeting." And she didn't know what a council meeting was. So I said, "Well, it didn't make it to council meeting. It was January." Grants do not typically get brought before council twice. It just doesn't happen. Matter of fact, a good friend of ours, Dr. Brian Gonzalez from Moffitt Cancer Research, who helped us with our grant stuff, he said, "John, this is not going to go to council if it didn't go." He's written 100 grants, I think, or
Mm.
something like that. So we did something called an A1 resubmission. We fixed the some of the stuff on the grant, and we can resubmit that, and then they can rescore it. Well, they did. They rescored this. They gave us a 20. By the way, a 20 is not perfect, but it's pretty good. It's a
Mm.
great score. The first one we got was a 46, and grants worked at 10's the highest score, and then
Got
if
it.
it goes, and the pay line was on this grant was like 40.
Interesting scale.
I know it's a weird scale, but the 40 was the pay line. So if you didn't get at least a 40,
Yeah.
you don't get you don't grant. We got a 46. It was below the pay line. Um, in May, we got an email that says your grant has been selected for funding.
Mm.
Right as we were running out of completely, right as this
When
point,
is
we're
this?
in May of 2019.
2010.
And I remember looking at, pardon me, May of 2020. Forgive me. It was the next year that it went to council. And I couldn't believe it. I was like, we looked to see, well, which grant is it? Is it the resubmission? They got the good score?
Yeah.
It wasn't. It was the 46. It was the one that didn't even make the pay line. That's the one they
Interesting.
selected. And I don't know exactly why, other than in my mind, I'm thinking to myself, this is God trying to show that he did this, not us. It's like I tell people, like, we wrote a crappy grant and somehow God got it funded. And that's what I really believe happened, by the way. So they gave us $1.7 million to continue to validate and study our program. And by the way, when you have not made any money at all as a company, hardly, to get a big infusion of capital like that, to do a 2-year study with the University of Florida to validate it, and this is a small business innovation research grant. A third of our score is for commercialization.
Mm.
So we spent 2.5 years pretty much figuring out the model. Again, nobody has this many lives in the industry. People, they die quicker than this.
Sure.
And so, yeah, we got the grant and then we studied it. It was during COVID. We had a really hard time recruiting
Yeah.
clinics.
I was gonna say that grant was right in the middle of it.
Yeah. But yeah, so we just kept fighting. And then, at sometime during that whole, commercialization, figuring our revenue model out, we realized that I had a good friend, Mazi Rosolnia, who just sold his company to Quest for quite a bit of money. Very successful entrepreneur. Sold a company called Pack Health. And I remember we met one day. He started his company right around the same time, and we were pretty good friends. And he said, "John, when you started your company, you set out to solve a problem. When I started mine, I set out to find out who could pay me, and then I solved their problems.
Mm.
And I thought that was really wise.
Yeah,
So we started to think, who can pay us? Who
sure.
who are the people in this industry that can pay us to keep our mission going? And so we pivoted and we started to work with some of the pharmaceutical and life sciences companies, which, you know, at this point, all the bad actors had pretty much been put out of business. These are really good, innovative companies that are helping the industry lessen its reliance on opioids. So a
Sure.
lot of device companies and non-opioid pharmaceutical products and
Yeah.
things like that.
I appreciate sharing that story. And again, going back to it, I feel like it's a lot about resilience and being mission driven and having a real steadfast approach in we do want to solve that problem. Although you are correct, it's tough when no one wants to pay you to solve the problem to keep going, but you figured out a way to make it happen. Um, and even despite okay, we got the money and now COVID happens, right? It's like one thing after another. Um, I have two questions in relation to the business. One, like what's the team like now? And where do you see that going in the future as far as like who needs to be on the ship with you to get to the next phase? And two, um, technology. Obviously it became like a platform. There was a platform component that was added into this. And you and I were talking before this about, AI. Where do you see that playing a role now that that's sort of been the new hot thing?
AI is definitely changing the industry. Healthcare is one of the slowest to adopt stuff like this. I think you have on the one side of the spectrum, you have all this innovation stuff that's occurring in the device space and all that, but then getting payers to pay for the stuff and getting physicians to adopt technology can be really challenging. But the team thing is important. You brought that up. We were fortunate enough to work with a guy named Charles Fred, who started a company called True Space. Charles was a very successful entrepreneur, many exits, and we were part of this cohort in Denver. And Charles has a way of breaking down the teams that I think is really genius. It's one of the best things I got out of this organization and meeting with them. He has a capture team, he has a keep team, he has a compete team, and he has a control team.
Mm.
And all four of those are how we see our team. Capture team is sales and marketing. Go out and get the business. Keep team is the team that's going to be the account managers to keep the business so that we can continue to get those recurring, that recurring revenue and continue to get those customers to stay with us. Compete team is the product side, so the
Mm.
software, but also its processes, internal processes. So how do you continue to refine those processes to cut costs, to be more efficient? And then how do you continue to develop new features? Software is moving so fast
Yeah.
that if you just put that out there and you're like, all right, here you go, it's done, it's never done.
Yeah.
And so we are constantly developing new features for our customers to add value. And then the control team is like the financial side and making sure that we're a solvent business that,
Right.
has insurance and all the other things that you need there. And so we have a really unique model. We have a two-sided market that we work in. On one side, we sell to physicians and physician practices and clinics and groups. And that's our inventory, right? So we call it a digital patient encounter. A patient goes through an interview. That interview, it's a very intuitive piece of software that learns from the way they answer questions. But that encounter produces a report that goes right into the EHR.
Mm.
But we're also pulling data out of the EHR as well, synthesizing that data. Software, in my eyes, software is input, calculation, output.
Yeah.
What inputs do you need? What should you do with that data? And then who needs to see it? What we're trying to do is deliver it to every person on the care team. So if the patient goes through our questionnaire, it produces this report. That report goes to the physician. Um, it's really the patient answering the questions that's our inventory, right? Or I should say, it's that report becomes our inventory. So, but on the other side of that, we have all of this data and we have all of these opportunities to help promote and help commercialize products that we think are a good fit to help lessen the industry's reliance on non-novel opioids.
Mm.
And so we're working with these life sciences companies. So it's kind of it's a tricky thing. It's not in most companies, it's like, okay, just here's the repeatable processes that everybody does so that all the cogs in the gear move so that the ship moves in the right direction or the vehicle moves in the right direction, right? So it's like, get up every morning and do this, and this produces this.
Mm.
It's a little different for us. We can't go too fast on one side. If I go sign up, you know, I don't know, all of the largest paying groups in the country, which we've done for the most part at this point. If we sign up all those groups without being careful to bring these customers along that end up really, this is where our revenue center is. Well, we have too much inventory. It's about managing that inventory to make sure that I've got enough for for the paying customers, but that I don't have too much because this is my cost center. So
Yeah.
revenue center, cost center. And so it's a game. It's just doing this.
Yeah.
So so as we do that, we're really being intentional about what team members are. If we go too heavy on sales, in most traditional businesses, it's like, we'll just hire a bunch of salespeople and sell the
Yeah.
crap out of the product and let's
Yeah.
go.
Yeah.
We do that, we're in trouble.
Yeah.
We
Yeah.
grow too fast. As Sanjay Singh says, at the stage you're in, John, you don't die from starvation, you die from indigestion. so, so,
Yeah.
um, so yeah, we're trying to make sure that we do that. But the team is really, it's super intentional. The product side is becoming more and more important to us, which is, I want my dream for this is that physicians have basically three pieces of software at the end of the day. They have their EHR, their RCM or their revenue cycle management, or their, uh, sometimes those are combined, by the way. And then that you have SureMed compliance, our product,
Yeah.
and that our product works with those other pieces of software to synthesize, extract, um, and deliver all the pieces of data that help
Yeah.
improve access and improve outcomes for patients.
Wow, that's pretty cool. Have you I heard it the other day from Mark Cuban, I think it was.
Who is
Regarding
that?
Mark Cuban, yeah.
No, Malik Cuban.
He's a little guy. I think he owned a basketball team or something like that.
Oh, yeah, I know
Yeah,
who
I
he
may have
is.
heard of him. He was talking about pharmacy benefit companies. I guess PBCs is the
PBMs, yeah,
PBMs,
yeah.
PBM. He was talking about just cost of acquisition of pharmaceuticals. Do you see that changing the overall industry in any way, and how are you related to that in any
No,
capacity?
not I mean, PBMs are the kind of the middlemen, and they're kind of controlling now what prescriptions. Unfortunately, there's way too many hands, too many chefs in the kitchen. They all have a middlemen are only there for one reason, and that's to make money.
Sure.
That is it. I mean, it's sold with the promise that we're going to streamline efficiencies, we're going to make things easier for these corporations and the people that are or these organizations that participate with them. But I agree 100% with Mark Cuban that PBMs are a problem.
Mm.
They're definitely raising the cost of pharmaceutical products. We don't have really anything to do with that. We don't. Our thing is really just education and awareness to the providers, so
Yeah.
that they're aware. You've got all of this new innovation in pain management now. 10 years ago, you didn't have it. You had opioids.
Yeah.
Now you have restorative peripheral nerve stimulators like the Reactivate product by Mainstay Medical, which is literally have 5-year data that it's changing patients' lives. It's restoring function. It's not palliative in the sense that it just blocks signaling. It actually makes people stronger,
Mm.
makes them better. That technology and what companies like Mainstay Medical are doing is innovative and very unique. And healthcare is slow to adopt things like that.
Mm.
Even with 5-year data, they're slow to adopt stuff like that. So we partner with Mainstay, for instance, and we do these virtual education seminars. We recruit throughout we'll probably have one of the largest, if not the largest network of pain management providers in the entire country.
What makes them slow to adopt, I guess?
I think it's just do no harm first, right? So I think physicians had take the Hippocratic Oath. They're used to slowly adopting things, waiting to see the data. You don't. But by the way, it's a mindset, right? This is the psychographic of the physician that goes, "I'm the early adopter of these products," and those those people are adopting all kinds of products right away. Some good, some not so good. But so I think there's just a depends on who you are as a physician, but the industry itself, though, is just geared that way because of the Hippocratic Oath.
Mm.
So, but what we want to do is we want to say, hey, listen, show them the actual compelling data. Remind them we have a new feature called Candidate Quiz Results, which allows physicians to select different criteria that they think is suitable for flagging certain patients for certain procedures that they
Yeah.
commonly do.
Yeah.
Um, More candidates for interventions, more candidates for procedures. That means typically a lot of times you can start to lessen your MME and reduce the opioid use that you have
Yeah.
to have.
Yeah.
And we're not anti-opioid, by the way,
Yeah.
just to be clear. We're appropriate use.
Right.
And it's just
Right. Yeah.
but certainly if you can be sparing with what you prescribe, it's better off for the patient.
Yeah. Moderation. Where do you see yourself in the growth phase now? Is this still startup for you? Or is it
No, I think we're post startup now. We're
cool?
we're actively commercializing the product. We're a profitable entity. We're on track to hit about 3 million in revenue next year. On the way to mid market. My goal is to hit 10 million in revenue by the next 3 to 5 years. We may be able to do it sooner than that if we can kind of scale. We're just being very intentional though with what
Yeah.
we're doing.
Yeah.
Our goal here is just really, really intentional. I think we have something special that we've built. I think we have more users. in the pain management space using our platform than any other digital healthcare company in the country
Wow.
outside of electronic health records. And so really focusing on strategic partnerships with companies that can add more value to what we do. We can add value where there's sort of like a lot of synergies there. Um, and then just continuing to take it, I mean, we've got a game plan. We set our goals every year. We change them. We pivot sometimes based on what we're seeing.
Yeah.
But at the end of the day, I'm a big believer. In Corinthians, it says that Paul says, I planted, Apollos watered, but God gave the increase. At the end of the day, we're going to plant, we're going to water, and we're going to watch God work and give us increase. And that's what I
Yeah.
think that's
Yeah.
what's been happening.
What do you think has to change as a leader, right? As the chief executive and sort of driving force in the company, as you go from 3 million to 10 million, and what are what's your value set or around the culture building and the team to get you where you were today, but also then to go from where you are today to where you want to be in that span?
Well, certainly what it takes to get to 1 million in revenue, totally different. I won't say totally. You still use all of those skill sets. You still need all of that, but I would say it's a different, you hire for different reasons in the beginning than you do towards getting to mid-market, right? You in the beginning, you just need people that are like a little crazy,
Yeah.
almost desperate.
A little bit, yeah.
Like me, I
You
mean,
gotta
people
be.
people say, "How did you just stay at this for so long?" It's like, well, if I was an attorney, I probably would have went back to practicing law. Like,
Yeah.
I didn't really have anything else to fall back on, and I think I was fortunate enough to have that idea that I just felt lucky to be here at some point. So many times in my career, I'm just like, I just feel so blessed and lucky that God chose me to do this, right? Because even if it doesn't turn into a $200 million company or whatever, it's like, look at the education that I got, look at the experiences that I've had, and all of the other things that have come with that. So I think what we're thinking about as we move towards that sort of mid-market is, what are the I'm less interested in people that need to be entrepreneurial. Let's just put it that way.
Hmm.
In the beginning, you need people that can pivot,
Yeah.
I got a guy on our team named Austin McCool. I got to give him a shout out just because, I mean, we've got a fantastic team. I don't want to snub anybody, but Austin's just been like a godsend to us. He's incredible. He was actually a rock star for 10 years, a touring musician. He started a band
Nice.
called Future Thieves out of Nashville. They're an awesome band. Met him at a show actually in New Orleans.
Oh, badass.
And then when the lead singer had a baby and they kind of broke the band up, I guess at that point, everybody decided to go do careers. And he's got his finance degree from Purdue. He's a smart, really smart guy. But we started him in the call center because he needed a job. He called me one day and I was like, come work in the call center. So we did that.
Sure.
He's now our chief operating officer and he's brilliant. But he had that mentality of, I could throw something at him and it would get done. I didn't even have to think about it. And it would be done better than I could expect. I could say, hey, here's a process that needs to be refined, or here's a problem that we're having right now. How do we fix it? And he would learn it.
Mm.
He'd watch YouTube videos sometimes or whatever. It's like, I think there's a software that can do this, or there's a product. And so you need that in the beginning when you're limited, when you got everybody's wearing 5, 10 different ball
Yeah.
caps, right? And it has different roles.
Yeah.
As you get to this sort of mid-market, you're really not. What I want is I want somebody that can do 3 things repeatedly every day when they wake up
Right.
in every department. I just do these 3 things well. Let's measure these 3 things and only these 3 things. I don't need people kind of jumping around doing all these different things because, that's the refinement of the business as you start to move
Yeah.
towards that
Yeah.
place. So I think hiring is going to be different. We're going to be looking for people that are certainly mission driven.
Mm.
We laugh a lot whenever we hire somebody. We always say, "Can we see that person on our calls, on our weekly calls? And are they going to be offended? Maybe not offended, but are they going to go like, what are these guys talking about? I
Yeah.
mean, I know that the whole reference of calling coworkers family is like, sort of sneered upon these days. It's like, they're not family. Family doesn't fire people. And I get
Sure.
that. I get
Sure.
it. But we love each other.
Sometimes people do in the
That is
family.
true. They do. Yeah.
Sometimes they do.
Yeah. I was going to make a joke and I just stopped myself. And I'm glad because this will be out in the public domain at some point.
Yes.
Um, but, but I think we want to make sure that this has to be enjoyable for us as well.
Yeah.
At the end of the day, money is not a goal. Putting money as a goal is just the silliest thing you can possibly do. It'll never satisfy. It'll
Yeah.
never, no matter how much you make. I will just tell you that one of my dearest friends, who's one of the early investors in our company, he's made so much money that more than he ever thought he would make in his life. And he's told me, he's like, it's, buys him whatever boat he wants, buys whatever house he wants, it doesn't fulfill,
Yeah.
it's always, so while you're on that journey, while you're going through all of this, we just want to I want to work with people that I like. I want to have a
Sure.
team of people that I enjoy being around. I want to laugh a lot. I want people that have my back like I have theirs.
Yeah.
And so we hire for that. But we're hiring for different skill sets, but we're never going to stop hiring for
Yeah.
who a person is at the core.
Right.
That's the most important thing.
Right. What would you say your biggest challenge is right now, either personally or in the business, that you feel like as a leader requires attention?
um we're going to need to grow. We need more people. I think my
Yeah.
biggest challenge is in finding people that
Yeah.
are wanting to work,
Yeah. Yeah.
that are excited to work. It's good that we can hire remotely now. But I will still talent's going to continue to be our biggest challenge, I think, as we grow. How do we find people that can really I always say if I had, you know, 3 more Austins, right? If I had 2 more Karens, if I had 2 more Sharons
Yeah.
um or even, all the we have a great team of people. There's not anybody on our team that is not just exceptionally good at what they do and very, very motivated
Right.
and willing to do whatever it takes. Um, but they're just rare. They're really rare.
Yeah.
So I think finding talent, um, regulatory challenges in this space are really tough. Because you're in healthcare and we're doing an industry, like I said, that's never been done before. So we don't have any kind of parity where we can say, like every time we move, every time we develop a feature, there's a full legal review that has to happen,
Yeah.
and that gets expensive, and that's takes time. If anything, it slows us down.
Yeah. Yeah. Yeah.
So I think regulatory pressures and things like that. I mean, when you're in healthcare and you're doing anything in healthcare at all, you're always one piece of legislation away from
Right.
being out of business.
Yeah.
So I think those are our biggest. That
Yeah.
if there's anything that keeps me up at night, it's regulatory stuff. It is data. We have a lot of PHI in our system. Now it's very, very secure through the group that we work with. But if there's anything that keeps me up, it's what if we have a breach in
Yeah.
PHI? What if there's a regulatory something that happens that basically changes our revenue model completely?
Right.
And then how do we find talent? Those are probably the three things I worry about the most.
Yeah. I mean, of course, like I think the talent piece, it's a challenge, and there's a lot of nuance there when it comes to putting people in the right seats too, right? You can have a really great person. You're like, wow, this is a person I would want to spend a lot of time with, and their skill sets maybe not align with exactly what you need in that moment. And you're like, I would like to bring them in somehow if there's a space, but not always the right fit for
Yeah,
the job. Like you said, hey, these three things specifically need to get done. We don't really need that right now, right? It's a challenge I've had when I've been looking for people that could be part of the mission,
right.
what we've been building. Um, so in the last few minutes here, quick hits, out what's someone do when they're outside of the 24 hours a day they're working on building a company for fun, and what else is important to you?
Jeez. I used to love to surf. I haven't done that in years, even though I'm an hour away from a pretty decent surf spot in Pensacola Beach. Um, right now, I just trying to stay healthy and stay in the gym, and I do a lot of boxing. I was an amateur boxer for many, many years, and so
Oh,
I
cool.
I teach on Wednesdays and try and do some of that to keep my head healthy. I'm raising 2 kids, and we got a family in Fairhope, Alabama. So I got a son who's about to be 18 years old and hopefully going to Auburn next year,
Nice.
and a 15-year-old daughter that um, is doing some cool stuff with this dogwood trail made stuff. So there's just a lot of family stuff. And yeah, I think in between, just trying to get a little exercise in. And um, most of my free time is just spent doing stuff with the family. I rarely,
Yeah,
and then travel schedule's been pretty crazy with work lately. So
sure.
we're really trying to, at the end of at the end of 2024, trying to dial that back a little bit so we can spend more time at home. But yeah.
Yeah, no, I get it. So boxing, amateur boxing, how did that, or what was the sort of precipice there for you when you were doing that?
So my brother and I, well, who Larry,
Yeah,
we went to
who's Larry?
a summer camp. Yeah,
You have a brother?
everyone knows Larry. Um, yeah, so we went to an all boys summer camp called Keewaydin in Vermont years ago when we were. So I think we're 9 years old when we first went. There was a boxing program that was there. It was an Olympic amateur boxing program, and we learned from a guy named Ned Pollock, and it's just been something that we've done for many, many years. I think we did it for probably close to most of our childhood, 9, 10 years, and
That's
then
great.
competed and, fought some amateur fights and, that kind of thing. And it just became a passion. So I've been doing it most of my life on and off. I've been doing it at some point or another. I've always had a
Yeah.
gym where I can have all my boxing stuff. And now we just recently set up a gym in Fairhope at the local
Oh, cool.
Fit Fairhope gym there, and I teach it on Wednesdays for, Olympic style boxing for, you know, adults and kids.
That's
So
cool. Guess you'll have to challenge Jake Paul now to a
yeah, yeah.
fight.
I'm not Tyson old, but I'm close. I'm close. I think I'm gonna wait on that.
Yeah, maybe. Where's the coolest place you ever surfed?
My favorite surf spot was Ecuador,
Oh, wow.
and Puerto Rico. I love Puerto Rico as well, but Puerto Rico got a little crowded in Domes and Playa de Marias there in Rincon. But Ecuador, Montanita was probably the best. I mean, it was just 8 to 10 feet on one day, breaking on a rock
Wow.
reef. It was a point break. It was absolutely just there's probably 8 people in the whole lineup. I mean, you'd surf all day long. I mean,
Yeah.
it's when I was on the Coast Guard, so I had some buddies. We took a trip that I
Oh,
surfed
you're in
with.
Coast Guard.
Yeah,
Cool.
yeah. So it was a Ecuador. That's my answer.
Sweet.
Yeah.
John, I appreciate you coming in and sharing a bit about the company and your journey and everything. It's inspiring. Listen, I think when you run a company, own a company, or in athletics, right? You're always going to come up against the pit of despair of like, hey, maybe this isn't going to work, right? But it's a story of resilience. And if you really care about the mission and care about what you're looking to accomplish and feel like you have a deeper motivation and fulfillment, that it can be done. And some people say it's like, oh, well, some people get lucky. I think you get lucky, or as you say, God put it in your path because you were putting in the work to be in the path, right? And that's really what it takes to just make things happen. So I appreciate your resilience, and especially helping solve a problem that really did become a massive issue in our country and needed to be regulated. And I've seen just so many, like in my history, of people that were affected by that negatively. So appreciate it, man.
Yeah. Thank you for having me, Michael.
Yeah,
Appreciate
brother.
it.